Welcome back to our channel. Today we're diving into a detailed discussion about Slynd, an estrogen-free oral contraceptive that might be just the right choice for some women. If you're new here, don't forget to hit that subscribe button for more medical insights. So, what exactly is Slynd? Slynd is a birth control pill, also known as a progestin-only pill, POP, designed to help prevent pregnancy in females who can become pregnant. Unlike many other contraceptives, Slynd does not contain estrogen, making it an excellent option for women who either need to avoid estrogen for health reasons or simply prefer an estrogen-free contraceptive. Slynd is effective at preventing pregnancy, but it's crucial to follow the directions closely to minimize your chances of getting pregnant. Remember, the better you adhere to the regimen, the more effective it will be. Slynd contains drospirenone, a type of progestin that can raise potassium levels in your blood. Because of this, Slynd is not recommended for women with kidney disease, adrenal insufficiency, or certain cancers, including cervical cancer. It's essential to have a thorough discussion with your healthcare provider to ensure Slynd is the right choice for you. You should also avoid Slynd if you have or have had liver disease, including liver tumors, unexplained vaginal bleeding, or a history of blood clots. If any of these conditions arise while you're on Slynd, stop taking it immediately and consult your healthcare provider. They can suggest a different method of birth control if necessary. Now, let's talk about how to take Slynd. Slynd comes in a 28-day blister pack with 24 white active tablets and 4 green inactive tablets. You should take 1 tablet daily, ideally at the same time each day, to maintain a consistent 24-hour interval between doses. This routine is crucial to maintaining the effectiveness of the pill. When starting Slynd, the timing depends on your current contraceptive method. If you're not using any hormonal birth control, start Slynd on the first day of your natural menstrual period. If you're switching from another birth control pill, vaginal ring, patch, implant, injection, or IUD, start Slynd on the day you would normally begin your next cycle or on the day of removal of your previous contraceptive method. Like all medications, Slynd has possible side effects. Serious side effects include high potassium levels, blood clots, bone loss, cervical cancer, liver problems, ectopic pregnancy, high blood sugar levels, and depression. If you experience symptoms like severe chest pain, sudden changes in vision, or intense headaches, seek medical attention right away. Common side effects include acne, headaches, breast tenderness, and changes in menstrual bleeding. Many women also experience unscheduled bleeding or spotting, particularly in the first few months of use. It's important to keep taking your pills on schedule even if you experience these changes. If you miss a period, especially if you haven't followed the pill schedule correctly, or if you miss 2 periods in a row, contact your healthcare provider immediately. Now, what if you miss a pill? If you miss 1 white active tablet, take it as soon as you remember and continue with the next one at the regular time. If you miss 2 or more active tablets, take the last missed tablet as soon as possible and continue with the rest. In this case, you'll need to use a non-hormonal backup birth control method for the next 7 days. As for the green inactive tablets, you can skip any missed doses and just continue with the next pill as scheduled. If you decide you want to become pregnant, you can stop taking Slynd at any time. It's often a good idea to have a pre-pregnancy checkup with your healthcare provider before stopping your birth control. In summary, Slynd is a versatile and effective contraceptive option for women who prefer or need to avoid estrogen. However, it's important to discuss your full medical history with your healthcare provider before starting Slynd to ensure it's the right choice for you. Thank you so much for watching! If you found this video helpful, please give it a thumbs up and don't forget to subscribe for more in-depth medical content. If you have any questions or topics you'd like us to cover, leave a comment below. Stay informed and take care.